Bon après-midi, tout le monde à ce point de presse. Good afternoon, everybody, and welcome to today's media availability. Joining us this afternoon, we have the Honourable Blaine Higgs, Premier of New Brunswick, the Honourable Doug Ford, Premier of Ontario, the Honourable Tim Houston, Premier of Nova Scotia, and the Honourable Dennis King, Premier of Prince Edward Island. L'Honourable Blaine Higgs, Premier Ministre de Nouveau-Brunswick, l'Honourable Doug Ford, Premier Ministre de l'Ontario, l'Honorable Tim Houston, Premier Ministre de la Nouvelle-Écosse, et l'Honorable Dennis King, Premier Ministre de l'Île de Prince-Édouard. Premier Higgs and Premier Ford will have some remarks, and then we will open it up to some media questions. But before I turn everything over to Premier Higgs, avant de céder la parole au Premier Ministre Higgs, voulez-vous assurer de désactiver le son de vos micros? I would like to ask everyone to please ensure your microphones are placed on mute. Premier Higgs.
Merci. Good afternoon. Bonjour. It's a pleasure to have the opportunity to meet with the Premier of Ontario, Nova Scotia, and Prince Edward Island to discuss our collective challenges and the steps that must be taken together to overcome them. The topics discussed today during the meeting, the crisis in healthcare, energy security through new energy sources and technologies, recruitment and retention of immigrants to address growing labor shortages, and reducing barriers for internationally trained workers in the healthcare sector. While these are all priority issues for each of us and have a direct impact on the residents of our provinces, healthcare is the utmost concern. Tous ces enjeux sont des priorités pour nous, car ils ont
and have a direct impact on the residents of our provinces. Healthcare is of utmost concern. Nous reconnaissons que des actions urgentes sont requises si le gouvernement fédéral veut assurer la durabilité des systèmes de santé dans le...
and protect residents. I want to thank Premier Ford, Premier Houston, and Premier King for coming to Moncton for this meeting and for the sometimes spirited but always positive and collaborative discussions. Je vous dis merci au Premier Ministre Ford,
Premier Houston, Premier King for coming to Moncton for this meeting and for the sometimes spirited discussions, but always positive and collaborative discussions.
There are challenges throughout our nation, certainly in healthcare and certainly with energy security. We see worldwide issues. And in relation to the role we can play collectively as a nation. We also know that we're stronger together, and that is certainly when these meetings are important, that we can have these discussions. And we know that innovative solutions are required in many, many steps, because it's not a matter of simply doing more of the same. It's about finding fundamental ways to improve. We know we're stronger together, and we will achieve our goals together. Thank you. Merci. Right now, I want to invite Premier Ford to welcome you to New Brunswick. And we appreciate you being here today, and we'd like to have some comments from your visit here, Premier Ford.
Well, thank you so much, Premier Higgs, and I want to thank the premiers from the Atlantic provinces for hosting us today. I want to also thank the Federal Minister, Dominic LeBlanc, for sitting down today and having a great conversation. And as Premier Higgs was saying, we've had a real productive meeting talking about multiple areas that we share in common. Healthcare is the number one priority, along with ourselves and all premiers across the province and along with the federal government. We look forward to having a collaborative relationship with the federal government. This is a Team Canada approach that we need to take, as all the premiers here have discussed. You know, when someone walks into an emergency room, be it in Halifax or Moncton, anywhere across this country, all the way up to Victoria and Vancouver and everything in between, they don't want to be sitting there for 10 to 12 hours. The backlog surgeries, they don't want to be waiting forever for a backlog surgery. We're working collaboratively together. We're going to come up with a strong solution that works for everyone in Canada. But again, we can't do it alone. We need the support of the federal government. Had a phenomenal conversation with the Minister LeBlanc today, and he wants to work with us. We all know Minister LeBlanc. He's done a great job in working with all the premiers. But I did mention to him, I can't have a conversation alone. This needs to be with all premiers from all provinces and territories to sit around the table and come up with a solution. Because doing the same over and over again, throwing billions and billions of dollars at a solution and keeping the status quo is just not working. We also need the partners from the healthcare sector. Every single CEO I've talked to from the largest hospitals in this country, talking to doctors, talking to nurses, the status quo is not working, folks. We need to be creative. We need to come up with ideas from the sector, not just us sitting around the table having a conversation, but it's a sector that matters. And we're going to work hand in hand with our CEOs of the hospitals and the docs and nurses, anyone who's involved in the sector, to come up with real solutions that we can deliver great healthcare in a rapid fashion. And again, not sitting in an emergency room for 12 hours to be seen. I'm very confident working with the federal government. We're going to come up with a great solution to make healthcare better and the best in the world right here in Canada, across the entire country from coast to coast to coast.
So, thank you, Premiers. We'll now proceed with questions from members of the media. There's a lot of people on the line, so we're going to try and do our best to accommodate, but we will not be getting to everyone. The reporters that are selected will have one question. You have the right to pose your question in the official language of your choice. Nous allons maintenant procéder aux questions des journalistes. Le journaliste choisi aura une question. Vous avez le droit de... Canadian Press.
The entire country from coast to coast to coast.
Or Premier Higgs.
Thank you, Premier.
Well, it's not about just ourselves. We need to sit at the table with the federal government, with all the premiers. And it's the same common issues that we see across the country. Again, no matter the conversation with Premier Houston or Premier King or Premier Higgs or myself, we're seeing the same issues. Backlogged emergency departments when you're pulling in and you're going to be sitting there for 10 to 12 hours, that's unacceptable. Backlog surgeries is unacceptable. How do we come up with a root cause of the problem? But do you know who can give us these answers and help us? Are the people in the sector, the healthcare sector. They're the experts, and I really rely on them in Ontario, and I know my colleagues rely on them as well. So we'll come out as a group and give you a strong plan to make sure we deliver better healthcare, because again, the status quo is not working here in Canada, right across the country. But with collaboration, cooperation, amongst all the provinces and territories and the federal government, we're going to come up with a great solution to make sure we deliver the best healthcare in the world.
Thank you very much. We're going to go to the phone line to Robert Benzie with the Toronto Star. Robert?
I didn't hear that question, Robert.
As we wait for Robert, we're going to go to Jacques Poitras from CBC. Jacques Poitras, CBC.
Hi, can you hear me okay?
Yes, thank you, Jacques. Please proceed with your question.
Hi, Premier Higgs. I'm just wondering if you've had any meetings or had any discussions or looked at any proposals to do anything from the private sector that's not currently being done by the private sector in the healthcare system in New Brunswick.
Well, I think one of the advantages here of having meetings like this is certainly the discussion that across this country we have a healthcare system in crisis. So for me, all options are on the table to understand what are best practices, not only throughout our country, but in other countries. What can we do differently in relation to how we deliver services and who can do it best? I think we've many times been stymied by, one political party after another that says, you do this and I won't do it when I get elected. Yeah. And that's why healthcare continues to erode in the country, and we don't get the changes we need. So I think what we certainly collectively agreed on is that this is a I will, for in former life, a customer service focus, but a patient focus in relation to what are people feeling and seeing when they go to the doctor or to receive health care. Our goal is to ensure that experience is a positive one and it gets the results we need. And we don't have the stories that we have heard of late and the critical nature of services being provided by people that are doing their very best to do for what's right for their colleagues. So yes, things are going to change, and yes, that could be in a different form, and I don't know what that's going to look like, but I want medical professionals to give us their best ideas, not just more of the same and hope for the best, but to give their best ideas to move forward in a constructive way that sees results for our patients and our citizens.
Thank you, Premier. Pascal Rochenog, Radio-Canada.
Oui, bonjour.
Yes, hello.
Ma question est pour...
My question is, Premier Higgs, can you please give us maybe one or two specific data on topics that were in your discussions? Maybe you didn't agree on things to do concretely, but the ideas that were discussed today, can you give us one or two topics, maybe specifically? Oui, absolument. Oui, je peux le faire. Les collègues ici peuvent ajouter à cela. Dans un cas, on le sait, par rapport...
And the need to have individuals that need better care, they need senior care, they need alternate care outside of a hospital. And I think the idea that we saw that during the pandemic, where each and every one of us had to really move quickly in terms of freeing up space in hospitals. And I think we've maybe allowed that to lapse a bit over the last year, and that needs to be a focus, so that not only do seniors get better care, but they get it in a place that delivers that care that they deserve and they need. And I think going in that direction is something we've learned from the past, and we need to make that happen. The other source in terms of ideas is in relation to who else can deliver the type of care that individuals need. So right today, the ERs are the be-all, end-all. So go to the emergency room because it's there. But are there alternate care? And we've all talked about this, and we're all doing it in some form, where we have different healthcare professionals, whether it be paramedics, whether it be pharmacists, whether it be nurse practitioners, but different people being triaged right at the door in the ER, and then deciding, okay, you could go maybe to a clinic tomorrow. Because we also know that doctors don't want to have a sole source of practice like they've had in the past. In New Brunswick, our sole source of practice is around 46%. The national average is 17%. And in that scenario, you say, today on the work-life balances, physicians want to have more time in the clinic with their colleagues and to serve patients when they need. So going forward, it may not be one-to-one, like I've got a doctor for life, but you could have a clinic for life. And you could have a clinic anywhere in the province when you need it. So the goal is to provide the service by the right professionals, not necessarily the same professionals. And I say, is that a goal? It's a challenge that we have right now because people, doctors work differently. The work-life balance is part of their life too. And you can't blame them for that. And so we need to have a practice that works for both our healthcare professionals and the patients that need the support.
Thank you.
Yeah, if I can just add, I just, it's important to get together for conversations such as this because, as Doug suggested and Blaine, some of the challenges we all face collectively as provinces are similar, but our abilities to provide some solutions are a little bit different. So Doug, for example, is trying to provide health care for 17 million Ontarians. In Prince Edward Island, I'm trying to find a reasonable solution for 165,000. So fundamentally, how we deliver that will probably be a little bit different. I have the ability, because we're a small jurisdiction, that we brought together all of the leads of every professional service, essentially in healthcare, to sit around the table in the cabinet room and say, this is the human resource that we have at our disposal. How can we deliver healthcare a little bit differently, changing the scopes, et cetera? That's probably a little more complicated for Doug to do because of the size and volume of people that he has. But I think fundamentally, everybody in Canada, everybody in Prince Edward Island would like to have access to healthcare when they need it as close to home as possible, and to get that health care in a reasonable time frame. And that's what we're trying to do, all of the challenges notwithstanding. But how Blaine does that, or how Tim does that, and Doug or Dennis and everybody else will probably look a little bit different. But what we talked about were those fundamentals of how we can achieve that for our citizens. And I don't think it's outrageous for a Canadian to want to go get access to healthcare service without having to be in the wrong lane or in the wrong line or have to wait for 15 hours to get it, when we have professionals who work within the service who can provide it. So I think that's what I took most from the conversations today.
Sure, yeah. Thank you. I mean, we live in a great country that people all over the world want to move to and want to live here. And there's even a bunch of provinces that are almost as nice as Nova Scotia. But so there's a significant discussion around accreditation of those healthcare professionals that were trained in another jurisdiction, another part of the world even. And how do we make sure that we can get them accredited here and maintain the healthcare outcomes, the standard of care that we Canadians have come to expect. So I think there's a big discussion to take place there. It's taking place in each of our provinces with each of our respective colleges. But I think it's a discussion that should be taking place on a national level as well. So accreditation, a big part of the discussion, because people want to come and live in Canada and they want to practice their healthcare skills here.
Thank you, Premiers. We're going to go on the line to Robert Benzie again from the Toronto Star.
Are you there, Robert?
Robert, if you're not there, we'll go to your colleague, Dustin Cook.
He's shy.
Moving on. Robert from Global TV. No questions? Okay. Adam Harris, Brunswick News.
Thanks, Bruce. Just wanted to follow up on the question about public-private partnerships. Premier Higgs, are there options in New Brunswick for that? Ontario's plan hopes to ease healthcare pressures by increasing publicly covered surgeries at private clinics. Do you see that happening in New Brunswick, or is it even a possibility?
Well, I think, Adam, we need to keep everything as a possibility in relation to how do we improve healthcare, but it has to be valid in that sense. And I think I want to make it very clear that, what we're talking about here is publicly funded healthcare. So it's not a case of healthcare not being publicly funded and people getting the service as they can possibly get it in the best format they can get it. So that would be the point, that, again, let's work on what is the best healthcare, and then let's figure out how we can actually ensure that's available to all citizens. So we leave the door open. I know, and Premier Ford may want to talk to their current plan, because I know that they recently introduced a health plan, and I believe with a new payment method.
Thank you. On va procéder avec M. Alexandre Boudreau, l'Acadie Nouvelle.
Monsieur le Premier ministre Higgs,
Acadie Nouvelle, Mr. Higgs, is there other things that the other provinces do in terms of healthcare that New Brunswick should do?
I'm sure there are, and we learn about that sometimes, obviously through discussions like this, and we talk about managing healthcare, let's say discharge and admissions in hospitals, and how we can maximize that so that we keep the space to keep people moving, but manage the system. For some time, I've talked about that we have an unmanaged healthcare system, for the most part, individually managed in individual departments or individual doctors or individual hospitals. And we don't learn from each other in terms of what is shared and of best practice nature. So I think that we don't have a formal process and of actually sharing what others learn. So these meetings are important, and the meetings of our staff to meet together to talk about healthcare. So when our ministers meet with their colleagues across the country and talk about healthcare practices, that's when these details kind of come out. And I think those are very valuable to do that, and to do them more routinely as we all learn, because we can share our results, and we don't have to reinvent the wheel. But what we do have to know is that our wheel needs to be reinvented. So if you got a process that works, great, let's emulate that across the country. But if you have a system that is broken And I guess I use that phrase because we've witnessed it across the country. It's not unique to any one province. It's consistent. We've all had our challenges. COVID has only, heightened that. But the time to make a difference is now. There's a sense of urgency now. And the status quo is just not acceptable anymore.
Thank you. My apologies. It's Dustin Cook with the Globe and Mail. So, Dustin, if you have a question.
And I guess, Bruce, I just want to, because I think some of my colleagues, and I know Premier Ford, I think you wanted to comment.
Go ahead.
Yeah, I've never seen in the last 4.5 years, I've been Premier, everyone focused, including the federal government, on one area. And as Premier Higgs said, best practices. That came up in our conversation today, actually. We need to start sharing best practices, better ways of doing things. What are you hearing in New Brunswick? What are you hearing in PEI and in Nova Scotia? And really support each other. That's never happened. I've never seen everyone as coordinated and focused for the entire country as we are now. And I think I can speak on behalf of our premiers here and all premiers. We want to deliver the best healthcare system in the world. We have the best country in the world. And with all the cooperation with the sector, with the federal government, and with all the premiers, I'm confident we're going to get there. And we're moving as quickly as possible. There's never been a focus on healthcare in the history of this country like's happening right now. Everyone working together. We'll get it resolved, and we'll get there, and we'll deliver better healthcare to the people of this great country.
Thank you. Jean Laroche, CBC, Nova Scotia.
Good afternoon, gentlemen. I'm just wondering, you keep talking about not having to reinvent the wheel, but the wheel needs reinventing, and I'd like to hear from, certainly from the Premier of Nova Scotia, what's standing in the way of the kind of innovation that you and the other premiers are talking about? Because I don't think the federal government would disagree that things need to be done differently.
Yeah, thanks, Sean. I think the answer is there's less and less standing in the way. More and more people are understanding that we have to do things a little differently. And I think in the past you've had different, if you think across healthcare, the spectrum, different groups, different professions would be a little territorial over which services they could provide, and maybe nobody else should be able to provide them. But I think you're seeing scopes expand. You're seeing pharmacists do more. You're seeing paramedics do more. And I think you're seeing a level of collaboration and acceptance of the necessary collaboration, at least across the spectrum, where the different trainings, different disciplines can support each other, all in the name of better healthcare for Nova Scotians, better healthcare for Canadians. So I think there's less and less standing in the way, and this is kind of a new thing. It's just kind of getting all the different groups at the table to talk about what can be done. And I think Premier Ford said, it might have been yesterday or today, but a lot of the solutions come from the people on the front line. So certainly in Nova Scotia, I would expect that Nova Scotians would start to see and hear about more pilot projects that have come from a doctor who has an idea, or come from a nurse who has an idea, or a pharmacist who has an idea, and we'll start to say, well, let's try that. Let's try things, because there's an open-mindedness. I think that creates an opportunity, and I think that opportunity is pretty fresh and pretty new in the way things go. So there's less and less in the way. The federal government has a role to play, certainly around immigration for healthcare professionals, maybe in the credentialing aspect, certainly in the funding aspect. So there's a seat for all kinds of different groups at the table, and I think all kinds of different groups are willing to take that seat now.
Thank you. We're going to go to Brittany Spencer from CBC PEI.
Hi there, can you hear me okay?
Yes.
Go ahead. Okay, thank you. Thank you for taking my questions. My question is for Premier King. Now, we've been hearing that the status quo cannot continue, and that on PEI, the healthcare system here is dealing with staffing shortages, closures of ERs and clinics, and doctors leaving. And so I'm wondering whether PEI has reached a crisis level within the healthcare system here, and what the first steps, the priority steps are that PEI needs to take to get the province away from that.
Well, hi, Brittany, and thanks for the question. I think PEI is not unique in the entire federation. I think there's call it a crisis or significant challenges, whatever the words you want to use. I think we have been realizing for the past year and a half, essentially, that we're not able to sustain the delivery system of healthcare that we have in the province. That's why we are bringing together all of the professionals to say, this is the roster of people that we have. How can we best utilize those people within the system? First of all, to make the system easier for those in the system who are stressed, and for the end user who's trying to get in to access healthcare. And I think that's a fundamental change in the approach. I think our government has resisted any temptation to come up with a political knee-jerk quick fix to try to put one problem in the basket while creating 15 others on the other side. So I think that's been something that we've been working on for a long time. But I really think that the people are much further ahead than perhaps we've given them credit for in the past. People are looking for access to healthcare services when they need them. It used to be that you needed a family doctor to be at the head of that, and now that is changing. And we're trying to build a team-based approach, a collaborative care model, so to speak, where maybe you have access to a doctor, but it's through a clinic, and there's going to be a whole lot of other people available within the system to give you some of the services that you may need. And it's going to fundamentally be different than what we've become reliant upon. But I think when we talk here about the status quo not working or the system being broken or whatever we want to talk about, is that we can't keep doing and trying to pretend we can do things that we can't do. So I think it's my job, it's the Minister of Health's job to lead those discussions with the health professionals, which we have been doing. But this isn't a political problem. It isn't a financial problem, so to speak. It's a system delivery model that we have to be open to changing. And like my colleagues here, I'm open to any good suggestion that can come forward from the health professionals who work within the system to make it better for the end user who needs to access that. So I learned a lot today. I've been learning a lot over the past couple of years, and we continue to learn. But I think the delivery of healthcare in PEI and across the country is going to be fundamentally different than it used to be. But I think it needs to be, and it's responding to the realities of today and tomorrow.
Thank you, Premier. We're going to go back to the phone line. Hélène avec Le Doigt Le Soleil.
Hello, everyone. Thanks for taking my question. My question is actually for all four Premier. Ottawa wants to establish a dental care program, and one of the options being contemplated would be that Ottawa would directly reimburse dentists without going through provinces. So if each of you could tell me where your province stands, do you agree with such a path? Where do you stand on dental care by Ottawa in general? Thank you.
Do you want me to start and move down the road? Well, I think, I don't want to be overly boastful, but I think Prince Edward Island probably is the best dental care program in the country, and I've been urging Dominic LeBlanc and the Prime Minister and others to, if they want to make a further investment in that from a federal perspective, that they should work within the system that we have in place and to help strengthen that. I'm encouraged that the federal government wants to spend some money in this important area, but we've heard a lot about creating wheels and recreating wheels. In this particular case in Prince Edward Island, I think we have a really, really strong model, and I will continue to encourage my federal colleagues that money should be put into the system that we have in place to expand the coverage and the offering, and I think we could serve Islanders best if we do that.
So I guess we've spent this first while, and we've been spending a lot of energy over the last number of months and years talking about a crisis in our current healthcare system. So adding more to it at this point in time would see a bit presumptuous in the sense of let's get what we've worked on for so many years fixed. The other aspect of looking at a new program, of course, is that if the federal government put it in place, and yes, they're going to fund it initially, well, then what happens to it then 4 or 5 years down the road? Is it something then that just gets handed to to the provincial governments. So I would say that firstly we need to really focus on the task at hand and not to create new ones, and let's get a handle on our healthcare system across this country. Secondly, in terms of a dental plan, let's understand what it really means, not the headline first and the details second, so that we actually know what it'll provide and what the cost will be ultimately, and can we provide what is being planned. Because right now we have a healthcare service that is not providing what was intended. So my certainly focus would be on our current situation, and let's get it fixed first.
Well, I concur with Premier Higgs on ongoing funding, no matter if it's childcare, and I think we all ended up getting a pretty good deal on childcare, no matter if it's CHT or the dental plan. We need ongoing funding. The worst thing you could do is give a chunk of money and all of a sudden get cut off in the next 2 or 3 years. We have a pretty good dental plan for seniors right now, that lower income seniors, over $100 million we'll put towards that plan. We want to expand on that, enhance that plan, but I'm open. I'm open to seeing what the federal government has to put on the table. But again, let's focus on healthcare. That's a number one priority. And yes, dental kind of falls under that. And we need to continue working on the healthcare plan to make sure we nail that down, and then we can move on to the dental plan as well.
Thank you, and I certainly agree. The goal is admirable. I mean, improved dental care is significant. It's important to somebody's overall health for sure. So I certainly agree with the goal. The details would be important. I wouldn't want to speculate on a rumor of how that may look. I'd rather hear directly on what the options are and why a certain option has been selected. And then, of course, overriding that is as has been expressed by my colleagues, is the longevity of the funding. Because if it's just to get a short-term headline and creates more funding issues and pressures down the road that cause other elements of service delivery to have to decline to keep it up, then nobody wants to get there. So I'm interested certainly in having that discussion with the federal government about the range of options they're considering, and hearing their assessment of which option is better.
Thank you. Last question, Steve McKinley, Toronto Star.
There you go. Toronto Star.
I don't know if something. I don't know. I like the Toronto Star, and Rob Benzie's a class act, but I'm not too sure what's happening over there right now. We'll have to find out when we get back home.
Last question will now go to Aidan Chimandi from iPolitics.
Nobody wants the last question.
No one wants last question?
Yeah, here we go. Go ahead.
No, beside you. Sorry.
Good try.
Hi, Premiers. We've heard a lot about healthcare, but I know you mentioned that energy security was another topic. Will any of the Premiers be attending the hydrogen conference in Newfoundland? And what role did hydrogen play in the energy security discussions today?
We will actually. So it turns out the Chancellor's visit, I believe, going to Montreal, and then in Premier Ford, you're heading home to meet with the Chancellor. My colleagues are here from Atlantic Canada because we're traveling together over for tomorrow to be in Steveville with our counterpart, Premier Fury. So yes, energy security is a big part of it. Hydrogen can be a big part of the future, and I think understanding, how we connect all the dots for improving and reducing carbon emissions and getting to a cleaner, greener environment. It's a process we're all undertaking and looking at all options, and I think that's part of this part of our discussion today, but part of the meeting tomorrow. I want to reiterate just one other point, because obviously understanding the cost going forward for energy and what that means to consumers throughout the country is critical, and we're seeing that. And we're seeing it with the crisis in Europe and what that's done to instability in the marketplace, but the demands that Europe would currently have. But another point that we also discussed, because it was, we talked accreditation, we talked about the actual immigration policies, and we also talked about the current concerns about drugs availability, and particularly for infants and And so we've agreed collectively that we want to understand our current inventory within our provinces, talking to the pharmacy associations, and understanding, what is a criticality. And, because in reality, we should be aware of that. Our healthcare professionals should be aware of that prior to it becoming a news story. We should know if we're getting to critical levels of critical drug supply. So we're all very keen to understand more about what are the triggers, what are the critical drugs that we're watching, and where do they stand in terms of supply.
And I just want to wrap this up by thanking our premiers again for hosting me here. And I have to tell you, folks, the people of Ontario, the 15 million people, first of all, I'd love everyone from Atlantic Canada to come to Ontario and visit, but I'll tell you, the 15 million people in Ontario, if you haven't been out here, you got to come out, and there's so many people from Ontario I've met. But the hospitality, they're salt of the earth people. I absolutely love coming here. I love the people. I'm going to give you one example. Myself and Premier Houston, we went out for a bite to eat last night, and I went to a table and said hello, and this lady and gentleman said, next time you come here, you're coming to my place for dinner. You don't have to just knock on the door. That's the type of people they are. They take the shirts off their back. You could knock on someone's door at dinner time. They'll invite you in, no questions asked. The salt of the earth, down to earth people. I love the Maritimers, and just can't wait to come back again. So thank you for your hospitality here, folks.
See how much we agree on?
Yeah, that's great.
Well,
and I had my first lobster sandwich today, too. That was good.
All right.
As you can tell, I don't miss too many meals, so they fed me well here.
Well, thank you, Premier, and Premier. Merci beaucoup à vous quatre. Thank you very much. That concludes today's press availability. Voilà la fin de notre point de presse. Merci beaucoup, tout le monde.
Thank you, merci.